Welcome to my podcast. Today I'm going to talk about another case which is very important and it's common in the UK and generally speaking, light skin. So basically, the patient will come to you. So after you introduce yourself, as we always agreed, and double check the patient name and date of birth, you will ask the patient, "How can I help you?" So the patient, whether it's a male or a female, she'll tell you, "Doctor, I'm having this red skin all the time. My face always keeps red, and it's embarrassing situation for me, and I just feel like flushed all the time with those kind of bumps. Sometimes can be asphalt spots, and it's really affecting my well-being, affecting my life. I can't do anything, can't go anywhere. I feel skin is burning and blushing mostly, and I can see those. Maybe she will say that I can see those broken blood vessel, and maybe she will say that I'm having sore eyes. Maybe the eyelid also is red. So usually, basically, the patient will complain of those kind of situations. So you'll ask, can you tell me more? Where about in the face? Anything that you think it is triggering it? Anything that you can do to reduce it or to help it? Any treatment have you used so far? And ask, of course, about past medical history, if there is any chronic condition or any well-known disease that the patient has and is taking any medication for in the long run, and if there is any history of allergy as well, and family history of some illness. So the patient will say, for instance, having this blushing over my face. Maybe she will specify, or you can observe by yourself, mostly affecting the nose, cheek, forehead, and it comes and go, and can affect the chin. In certain situations, can be so severe in the eyes, and others can be the neck, chest. And the patient will say, "I'm having this sort of stinging or burning, feeling warm, hot all the time," and in such a situation can be painful. The patient might, in certain situation, have bigger nodules in the skin, so it could proceed from small red bumps to larger granulomatous skin type. And if the patient has soreness or crusting in the eye, it means that's affecting the eye, so it's called in this time eye of rosacea. And in such a situation, because it's a long-term condition, the skin can get thickened as the time goes. So in this situation, you need basically to differentiate and have some, at least few, differentiate in your mind. So basically, you will think about rosacea, you will think about acne, you will think about seborrheic dermatitis as well, contact dermatitis and lupus, in certain situation, keratosis pilaris. But the main one is just, as I say, acne, rosacea, seborrheic dermatitis, because they are quite common. Contact dermatitis as well is common. Lupus, of course, if the patient has any family history, or maybe just the patient themselves, but you just need to rule out. So we know in seborrheic dermatitis, it's usually the crust around the eyelashes, and mostly it will affect the sebum secretion area, so basically in the center of the face, anterior chest, eyebrow. And lupus, the patient will say the main trigger is the sun, and there is specific criteria as well about diagnosing, ruling out lupus. Contact dermatitis, the patient might say that I used something and I noticed immediately after some time I got this skin reaction. So you just need to rule out differential, just few in your mind while you are asking the patient. And then you will ask about the triggers. Usually in rosacea, the triggers is sunlight, humidity. You'll ask if there is any food that triggers the condition, like for instance, it's well known for spicy food, hot drinks, tomato, citrus fruit, chocolate, also those kind of aged cheese, any processed meat, any histamine releasing product can all cause rosacea and aggravate it. Also alcohol, mainly wine, and also strenuous exercise and stress, all of that can trigger rosacea. And you need to explain to the patient that rosacea can be controlled but cannot be cured, sadly. And if the patient, for instance, has eye manifestation, you need to, of course, examine the patient, and if there is any need for a referral, you just refer them to the specialist, which is basically ophthalmologist in this situation. And also ask them if they have photophobia or feeling grittiness in their eye or the vision declined, if there's any painful eye. So that's basically you just need to bring to their attention in order just to safety net if the condition or it's just like a red flag. So when you agreed about all of that and examined the patient and you had the diagnosis of rosacea in your mind, so I need to agree with the patient how we can move forward and how can we bring this under control and explain the situation. As I say from early on, if they have any thoughts about what could cause their issue, and if there is any ideas or thoughts and what's their expectation order to move this successfully, rather than the patient might come to you and thinking that it will be cured. So you just need to bring this to the patient attention and explain the whole situation, and you can hand them a leaflet just to read about it and have some basic information about the condition. So you will encourage the patient to avoid, of course, as we know that the main trigger is the sun, so ask the patient to avoid the sun and use sunscreen with high SPF, at least the least is 30 and go upward. Also ask them if they are using any skincare, daily skincare, so ask them to avoid the harsh one, however they can use the gentle one. And of course encourage them to drink a lot of water to keep the skin hydrated. And if there is any possibility to get a humidifier, this will help as well in the home. And tell them if they have any thoughts, because sometimes the patient might think this rosacea is just because of poor skin hygiene and might think that it's contagious. We need to explain that it's not the situation. However, if the skin is too much affected and it just in the long run might disfigure the skin and cause thickening, as I say, and some granulomatous might develop in the face if that's advanced condition, of course. And of course it will cause enlargement of the nose, so you can see that in a certain area, and even in the UK an old man sometimes will have rhinophoma of their nose, which is quite bulky and nodulous or bulbous nose, which of course can only be treated by laser to just cut around and define the original nose. You will also tell them that I need to give you antibiotic, and mostly in this situation it's mostly tetracycline. However, in certain situation you could give other antibiotic, but mostly the main treatment is tetracycline, and arrange for them to be seen by the specialist, which is basically the dermatologist. So dermatologist will take time for them to wait for, so basically you need to start them on treatment and explain the situation to get it under control and find out what could be the trigger in their situation in order to bring it under control. So basically by that I hope that I covered most of the important points that you might need in Lab 2 for rosacea control, which is common in the UK. And I see you in another podcast. Thank you.